Hi, I'm Dr. Tanzov from Department of Psychiatry in number 1 Defense Services General Hospital. As a psychiatrist, we have to see a lot of patients and prescribe to medications depending on their particular symptoms. So in psychiatry, only prescriptions of medications is not enough, and then so we have to uh, change the underlying thinking style and mental status of the particular patients is also an important part in psychiatry and in psychiatric management. So today I'd like to point out some non-pharmacological approaches to the particular patient's problem. So any idea of mental activities or mind have a lot of functions like thinking, decision making, and a feeling and knowing of his own existence, like sense of selves, and the other kind of like yes, and then thinking. So in the functions of mind, like thinking, we have core ideas, like and core beliefs that already exist in our mind. So depending on the different individuals, the other or each and everybody believe that what he or she is thinking is right. But actually, we may have a lot of errors and a lot of flaws in our ideas and our thinking. Uh, for example, for a patient with depression, so the depression is medically concluded to be with some cognitive problems like reduced mental activity and sensorium and thinking and like executive functions, and ineffective problems like low mood and anhedonia, and behavioral problems like reduced in interest in eating, sleeping, and even in other activities of daily living. So in the cognitions of a depressed individual, he may have several kinds of depressive cognition like dichotomous or white and black thinking, and tunnel vision, and again the sometimes a selective remembrance and aberrant detection. Like these kinds of depressive cognitions make the person concluded to be more negative way. It is called the negatively biased information processing. So the patient may have all the negative feeling and emotions in his own. It's called self, and then all the things happening around him, like environment and about his future events, like his future. So in his self, environment, a future, and depending on his severity of illnesses, he may have all the negative emotions, all the negative ideas about these three events. So after we have prescribed some medications appropriate for his particular severity, particular kind of symptoms, we have also to change his mind with cognitive restoration or cognitive restructuring, depending on the kind of his cognitive aberrant cognitive conditions. The patient may has that he is such a weird and such a loser, and he experienced all the things is failed, all the wrong things, all the bad things in his life. So in its particular event he is going to do, he will also put some idea in his mind that he will feel that event too. So it is sometimes it's quite disturbing for him to move forward in his life. So we have to change his mind that, so in helping the patients to make a question himself, what why, how, and to what extent. So in what questions, so what kind of idea, what kind of worriness do you have related with your particular event? So for example, the patient is going to sit for an interview for his new job, so he will already kept the idea in his mind that as he is a loser, he will also fail in the interview like this. So what in the next questions, why do you have such idea? So are you how much do you have a certainty for your idea? So how much do you have a chance to fail in your interview? So we have to help the patients to analyze or to categorize and to evaluate his ideas to what extent it is true. So and so and how, and in the questions of how, so how will it happen and how will be happen in the future? So do we help the patients to analyze that the idea depending on his mood and cognition. So it is very important to have the ability for a particular therapist to sympathize or to see with the specific clinical knowledge in the brain, what the particular patient is suffering from, what sort of kinds of cognitive disorder or depressive cognition or something like that. So it's an important ability for a particular therapist to be able to help the patients to a better thinking style, and which again to move his better life.